I find it extraordinary and frankly shocking. I've just done a post about this actually, but the more I think about it, the more I think I have to say a little bit more. There are so many whistleblowers in the NHS who have lost their jobs, their livelihood, their future, because they insist on speaking out about the abuse, the bureaucratic mess that the NHS is in, and the desperation by the system to ensure that the system is not challenged. The system needs to be challenged. And the GMC, the General Medical Council, is part of that cadre of bullies, frankly, who are determined to ensure that people don't speak out about their control. And at the same time, they're quite happy to keep racists and bigots and thugs on their books. So I just made a piece about a man who was writing the most appalling stuff. Dr. Dimitrios Psaradakis. I made reference to Dr. Wahid Shahida, who ran an Islamic group and had praised the October the 7th Hamas terrorist attack, but is still able to practice as a GP. He called the October the 7th Hamas attack a welcome punch on the nose to Israel. But there's also Dr. Martin Whyte, who's a paediatrician, who was sacked from his role on the British Medical Association when he wrote Zeke Heil, ha ha ha, gas the Jews. But he's also still able to practice without any restrictions by the GMC. There's a point at which one has to say, what is going on in this nonsense? Are these people protecting themselves, or are they protecting us? And it seems like so much of the medical profession, the hierarchy of medicine is there to protect itself, not to protect the clients, the patients, ordinary people from abuse. So if you raise an issue, if you raise a question about competence or behavior, the chances are, it seems, that you're going to be silenced, and every effort is going to be made to ensure that your valid observation doesn't get out. Everything is going to be done legally to stop the case getting to court. Everything is going to be done, not only at that point, not only by the medical professions, but by the government and by senior legal bureaucrats. Not by judges. It's the bureaucrats who topple the system. It's the bureaucrats who will not advance the paperwork. And it's not just once that I've seen this, it's many times I've seen this. And only by facing up to failure in the system is the system going to improve. But by hiding that failure and attacking the people who are calling out what is wrong, just perpetuates the problems, and it makes those problems worse and worse. It's like walking around the place with some sort of canker. It can only get worse the more you refuse to acknowledge that it exists. It needs rooting out. And then the health system may work. It's not just, as I say, it's not just about the NHS, it's about the entire health system across our country. It's shot through with self-preservation and with a desire to make money and penalize those people who call out any wrongdoing, and protect people who shouldn't be doing the job. This goes all the way up to bureaucrats and practitioners who are dodgy. I would certainly be very worried about being treated by a racist doctor, a prejudiced doctor who is on record as being such. I would be very worried about that. It's not just about... I think there's every opportunity to re-educate people. Great. Nothing better than somebody who has been taught that his language or her language is wrong to be apologetic and to move forward. But to pretend that this isn't inappropriate behaviour is to live in cloud cuckoo land and not to be protecting the public. We need medical practitioners on whom we can rely. And that means the service needs to be there to be reliable. And at the moment it isn't.